Hello again. Thanks to recent changes in Medicare laws, financial help is available to most seniors in this country in paying for prescription drugs. When can you sign up for benefits? What benefits are you entitled to? How can you obtain the most favorable rates? All those questions and more are making many people's heads spin. The portion of the Medicare laws that governs prescription drug plans is called Medicare Part D. Here are a few things you need to know about it.
Have to pay 5%. So the first thing people need to understand is this is insurance.
It's the biggest change in Medicare since the federal health insurance program started back in 1965. Medicare Part D is prescription drug coverage aimed at helping people with Medicare. But unlike the original Medicare program, the drug benefit is offered through private insurance plans that will be reimbursed by the federal government.
What tier their drug was on.
I don't take that much medication, so that's what I'm saying.
But for some seniors, like Peggy Ann Bailey, the enormous amount of plan choices is simply overwhelming. That's when people like Pat Venable step in to help maneuver through the maze.
First and second page of this will tell you a summary about what Medicare D is about.
Pat is a coordinator with the State Health Insurance Assistance Program, or SHIP, a national program that offers help to people with Medicare to understand and enroll in a drug plan.
It is confusing, and Medicare has worked very hard through the SHIP counselors, through 1-800-Medicare, through advertising opportunities to help people understand.
That's why 66-year-old Peggy Ann has come to this free Medicare seminar at her local senior center, doing her homework on what will be the best plan to ensure her health.
You got a choice between all these plans, and it's so difficult to find out which one that is good for yourself, okay?
With me to help us understand some of the twists and turns of Medicare Part D is Amy Larrick. Ms. Larrick is lead trainer for the National Medicare Training Program at the Centers for Medicare and Medicaid Services, or CMS, in Baltimore, Maryland. She was responsible for developing training materials and resources for CMS partners and presented them at several workshops and conferences throughout the nation during the implementation of the Medicare prescription drug coverage. She previously served as the training coordinator for the Nebraska Senior Health Insurance Information Program. Also joining us is Patricia Smith, who is Vice President for Regulatory Affairs at America's Health Insurance Plans, known as AHIP. While at AHIP, she has developed the new Medicare Prescription Drug Plan Guide, How to Choose Your 2007 Plan. Tricia previously spent 2 years as the Director of the Medicare Advantage Group at the Centers for Medicare and Medicaid Services, CMS, the federal agency that runs the Medicare program. She also worked for 15 years for the American Association of Retired Persons, or ARP, leading its federal health care lobbying work. Welcome to you both. Thanks for being here today. Amy, I know this is a tough, long question, but could you explain Medicare Part D for us?
Sure. Well, basically, Medicare Part D is Medicare prescription drug coverage. It started January 1st, 2006, which was the first time that Medicare has really provided comprehensive drug coverage. So it was exciting because most people who signed up for a prescription drug plan this year can save about 50% of their drug costs. So as we're looking towards 2007, we're talking to people about choosing their plan that they want to have for 2007.
Tricia, who is actually eligible for Medicare Part D?
Anyone who is eligible for Medicare. So if you have met the requirements for the Medicare program, you are also eligible to purchase a Medicare Part D plan.
When can a senior first sign up for Medicare Part D?
At the point that they are eligible for Medicare. So at the point they turn 65, or for people on prescription drug coverage, if they signed up last year, then as you said, they should be looking at what their choices are for the coming year. If they didn't sign up last year and were eligible, they should, because of the penalty that they may be looking at, they should seriously consider, and probably it would be a smart move for them to join up.
Let's talk a little bit about that penalty, because it is a fairly intense penalty. Why is it so intense?
Congress put it in place because if an individual doesn't, it's an insurance principle, if an individual doesn't sign up for prescription drug coverage when they're first eligible for Medicare, in effect they're staying out of the program until they need it. And so if at that point they enter and the program gets to be more and more expensive. Insurance works in Medicare or elsewhere because you get lots of people in the group, and that group then helps, if you're healthy, you help people who are sick, and then when you get sicker, then those costs all come together to help pay for you.
So this is actually, just to reiterate, 1% per month in they're penalized 1% per month, and that never goes away through the duration of your coverage, right. Correct?
That's right.
Now, we talked a little bit about creditable coverage. Creditable coverage. What is that?
Creditable coverage is an affirmation that your employer-based insurance that you may have in retirement, so let's say you worked for an employer, that employer gives you retiree health insurance, and in that is prescription drug coverage. Creditable coverage is basically a statement that says your retiree coverage from your previous employer is equal to what is available in Medicare. And if that's the case, then that employer will send you a letter that says that you have creditable coverage. And so for those beneficiaries, they should be in touch with their employer and make sure that that's the kind of coverage they want to continue to have. They still have the option of going into the standard Medicare program. But for most people, creditable coverage through their employer is going to be the smart thing to do.
Amy, what tips do you have for people who need some help to lower the expenses of their prescription drugs?
Well, the first tip would be to look into signing up for Medicare prescription drug plan if they haven't already. That'd be the best way. Like I said, most people can save about 50% on their cost of their drugs. Another thing they can do is consider talking to their doctor about switching to generic medications. A lot of the plans actually offer lower copays for generics. Some actually have no copays for generics.
But talking about that, what if a person's drugs are actually not on the Medicare plans?
If the person is on a prescription that's not on their Medicare plan, there's a couple things they can do. The first thing they can do is actually talk to their doctor and see if their doctor would put them on a drug that's on the Medicare plan, because all the plans are required to cover at least 2 drugs in every category. So no matter what, there's going to be a drug on there that could treat their condition. If they talk to their doctor and their doctor says it's medically necessary that they have to be on that medication that they're on, then the doctor can actually work with the plan and ask for an exception so the plan will cover that drug for them.
Okay, great. We'll be back in just one moment. We've got to take another brief break. We'll be back in a moment to continue our conversation about Medicare Part D with Amy Larrick and Tricia Smith.
Do you know? When did the U.S. Medicare program start? Do you know the answer? Medicare was enacted in July 1965, with the first beneficiaries signing up approximately 1 year later.
Welcome back. On the latter part of today's Daily Apple, we've been learning about some of the intricacies of Medicare Part D, the portion of the Medicare laws that covers prescription medicines. Here to help us understand it is Amy Larrick, lead trainer for the National Medicare Training Program at the Centers for Medicare and Medicaid Services in Baltimore, Maryland. Also with us is Tricia Smith. She's the Vice President for Regulatory Affairs at America's Health Insurance Plans. Welcome back, ladies. You know, the big question is always, why is it so complicated to sign up for Medicare Part D?
You know, it's really not as complicated as a lot of people have made it out to be. When you think about the insurance, the health insurance that all of us have in the employer market, where our employers provide insurance options for us, this is really very much the same thing that people are now in Medicare able to take advantage of. What we're looking at is a first-year transition, and indeed, it's a huge program. Medicare has not had a change of this nature since it was created in the mid-1960s. We have a benefit in place that's now providing somewhere between $1,000 to $1,200 a year on average to Medicare beneficiaries. That didn't exist before. But in order to do that and do that right, and also ensure that Medicare beneficiaries would have some choices so that you wouldn't just have one benefit and everybody would have to go into that single idea, that there would be some options, just like we tend to have in the employer market.
Amy, talking about options, does every senior have to sign up for Medicare Part D?
No, Medicare Part D is an optional program, so they can choose whether they want to. Tricia mentioned that some people who are already in an employer plan that's as good as Medicare's may not want to take Medicare Part D at this point. But most people, even if they don't have a lot of prescription drug costs right now, will eventually. So it's a good idea to get a prescription drug plan for kind of peace of mind in the future, too.
Now, I understand that there are two types of this plan. One is the standard Medicare plan, right, and the other one is Advantage plan. Can you distinguish between the two for us, please?
Sure. Medicare prescription drug plans, standalone plans, are what most people who are in what we call original Medicare. So they have Medicare Part A, Medicare Part B, and then they might have a Medicare supplement policy or Medigap paying after when they go to the doctor.
Right.
And now they add on a standalone Medicare prescription drug plan to cover their drugs. And then the other option that you mentioned is Medicare Advantage plans, which are like Medicare HMOs and Medicare PPOs, which are basically private companies, and a person's going to get all their Medicare benefits, their Medicare hospital, their doctor visits, and their drug coverage, all from that same company.
Is Medicare Part D expensive to sign up for?
Not generally for people. It costs a little bit of money in premiums or coinsurance for most plans. But when you think about what you're getting from the government and what this benefit now provides, it's certainly a good move for almost every beneficiary, unless, as we've talked about, you have your employer-based insurance. You can get a very low, either a zero or a very low premium plan.
The average is $25.
The average, the national average is $25, but or roughly $25. But in most communities you can find plans that cost less than that, and it really depends on what your needs are. For instance, Alex, if you are a consumer who has very few drug costs. Let's say you're incredibly healthy and you're still running marathons and you only have maybe one drug that you're taking on a regular basis, and that's not that expensive. It probably is a wise idea for you to pick a plan that has a low premium and it's only going to charge you, you know how much your cost sharing or your copay is going to be each time you need to get that drug filled. So that's probably, you pick a low premium plan and something where you've got a predictable, but it may be a slightly higher cost sharing. But if you're someone who has 5 or 10 drugs that you need to get, and those drugs are pretty expensive, it's probably to your advantage to find a plan that has a slightly higher premium, so you have a stable monthly payment that you're paying in premium. And then you find also a plan that's going to give you your drugs with lower copays. So that's, you know, it's a balance.
Right.
And that's what Congress has constructed here, is something that lets people figure out what their needs are.
Right. But Amy, clearly at this point it's a good time to bring up the donut hole, or the infamous donut hole, where, if I understand correctly, $2,200 is the average that people were paying for prescription drugs. With the Medicare plan, they're spending on average $1,100, but there's this gap that if you spend over a certain amount on prescription drugs, you fall into this hole. Can you explain why that's there and what that's all about?
Sure. Congress created the law so that they could help a lot of people help save money on their prescriptions. On average, like you said, about $1,200. And so after they've gone through a certain dollar amount, they do hit what we call the coverage gap. And then once they've gone through that coverage gap, in 2006, once they've paid $3,600 out of pocket on their drugs, that's when they reach catastrophic coverage. And that's one of the really good things about Medicare Part D, is that catastrophic coverage. So they really wanted to help people in the beginning, and they really wanted to be able to provide catastrophic coverage. So if somebody does have something happen, you know, they will have that coverage. Because after they've reached that limit, they're going to have to pay very little for their drug costs. On average, no more than 5%. 5%.
Mm-hmm. It's still very confusing, and I know that Medicare or CMS is trying desperately to get information out. What are you doing to make that happen?
There's all sorts of information going out. One of the big things was the Medicare and You 2007 handbook. So every house that has a person with Medicare in it received one of these Medicare and You handbooks the end of October, 1st of November. And it talks about their Medicare coverage, including Part D. So that's one of the big things that's gone out. There's also a lot of information on the Medicare.gov website about the prescription drug plans, and can help them compare plans, and all the same information is available on 1-800-MEDICARE for a person who can call 1-800-MEDICARE.
And I also just want to show Tricia the book that you put together, which is a planning guide on Medicare Prescription Drug Plan Guide. If an individual has a spouse that is a part of Medicare, how does it work in terms of families?
Well, it depends on, I'm assuming that the question you're asking is one person is qualified, let's say is 65 years old or older, and the other person is younger. Then you have two different kinds of coverage. The person who's under the age of 65 is not yet on Medicare. They're getting their insurance separately, whether that be from an employer or individually purchased, and the person who's on Medicare gets their coverage through the Medicare program. That's the way the Medicare program has worked, not just for Part D, but for everything.
And how about if your spouse is deceased?
If your spouse is deceased and that person qualified for Medicare coverage and you had Medicare coverage while they were alive, you continue to get it as the recipient of that coverage. My mother, for example, is in precisely that situation. My father died, and she has insurance coverage based on my father's payment of Social Security.
Amy, before we close, what is the enrollment period for this?
The enrollment period, everybody has an initial enrollment period like Tricia talked about, but then what's coming up right now is actually what we call the annual coordinated election period, or the open enrollment period. You may hear it called that. It's from November 15th to December 31st.
And people can either join into the prescription D, Medicare Plan D, or they can change their plan during that open enrollment period,
That's
right?
exactly right.